You have likely sat in that sterile, white-walled examination room, feeling the familiar prick of a needle, waiting for a verdict that could dictate the next decade of your life. When the envelope arrives, or the digital notification pings on your phone, you scan for those 3 digits, your total cholesterol. For millions, a number above 200 triggers a visceral sense of alarm, a feeling that your arteries are quietly turning into limestone. We are conditioned to view these readings as the ultimate scorecard of our cardiovascular destiny. What if the standard metrics we have relied on for 40 years are not merely incomplete, but fundamentally misleading? Before we pull back the curtain on this medical paradigm, please understand that this content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns before making any changes to your treatment plan. With that in mind, consider the unsettling reality that thousands of individuals suffer heart attacks every year despite having perfectly normal cholesterol levels. Conversely, countless people live long, vibrant lives with numbers that would make a conventional practitioner reach for a prescription pad immediately. Is it possible that we have been obsessing over a symptom rather than the root cause? Research suggests that our singular focus on total cholesterol has blinded us to more sophisticated markers of vascular health. Studies indicate that the biology of your blood is far more nuanced than a simple high or low reading can capture. When medical professionals recommend aggressive intervention based on these static numbers alone, they may be missing the forest for the trees. We are standing at the edge of a significant shift in how we understand heart health, moving away from outdated dogma toward a more precise, individualized science. In the next few minutes, we are going to dismantle the misconceptions that have governed your health decisions for far too long, and uncover the hidden metrics that actually tell the truth about what is happening inside your arteries. For decades, your annual physical has relied on a crude, two-dimensional snapshot of your cardiovascular risk. Standard lipid panels categorize cholesterol into simple buckets, the good HDL and the bad LDL, as if these molecules were monolithic blocks of solid matter. In reality, your blood is a complex, turbulent highway, and the particles carrying lipids are far more nuanced than a single milligram per deciliter measurement can convey. Think of cholesterol not as a static substance, but as a cargo ship navigating your vascular system. Research suggests that the true danger lies not in the total volume of cargo, but in the physical characteristics of the vessel itself. These lipoproteins vary wildly in size and density, ranging from large, buoyant, fluffy spheres to small, dense, jagged particles. Studies indicate that while large particles float harmlessly through your bloodstream like beach balls on a gentle tide, their smaller, denser counterparts act like microscopic shrapnel. When you receive a total LDL reading, you are essentially counting the number of ships in the harbor without knowing if they are sturdy freighters or volatile, piercing projectiles. A high total cholesterol number might consist entirely of harmless, buoyant vessels, while a normal range could hide a dangerous concentration of these aggressive, dense particles. This is why standard testing often fails to predict cardiac events. It misses the structural integrity of the lipids currently circulating in your veins. The medical establishment has spent years fixating on the destination, the total concentration, while completely ignoring the quality of the transit. By focusing exclusively on the binary of high versus low, we have been blind to the underlying architecture of metabolic health. Your arteries do not care about the average density of your blood, they care about the specific, physical interactions occurring at the microscopic level. If your physician only looks at the aggregate, they are reading the summary of a book while ignoring the content of every single page. But how do these particles actually begin the process of arterial damage once they bypass your defenses? The arterial wall is not a passive pipe, it is a living, breathing landscape that reacts violently to the internal weather of your bloodstream. When we fixate on total cholesterol, we are staring at the traffic flow while ignoring the fact that the road itself is crumbling. Research suggests that the true catalyst for cardiovascular distress is not the presence of lipids, but the structural integrity of the endothelium, the delicate lining of your vessels. Studies indicate that chronic inflammation acts like a corrosive acid, stripping away the protective barriers that normally repel circulating particles. Once this barrier is compromised, it creates microscopic fissures, essentially sending an open invitation for debris to lodge itself into your arterial walls. This is where insulin resistance emerges as a silent architect of chaos. When your cells stop responding to insulin, your body compensates with a constant, damaging surge of the hormone, which actively promotes the oxidation of fats. Your lifestyle is the primary switch that dictates whether this environment is one of healing or one of rapid decay. A diet saturated in ultra-processed sugars and refined oils functions as a constant trigger, firing off inflammatory signals that keep your immune system in a state of perpetual, exhausting defense. When your metabolic engine is misfiring, your body loses its ability to clear away the cellular waste that accumulates within your arteries. You aren't just dealing with a high lipid count, you are dealing with a systemic environment that has lost its capacity to repair itself. High cholesterol is often merely a symptom of a much deeper metabolic disturbance, a desperate attempt by the body to patch holes created by oxidative damage. If we ignore the insulin spikes and the inflammatory fire, we are simply putting a bandage over a fracture. The vessel wall is crying out for balance, not for a suppression of its own natural transport mechanisms. But what happens when the very mechanism meant to protect you, your own immune system, mistakes your healthy tissue for an enemy? The trap is set in the quietest corners of your physiology. Inflammation is not a silent guest, it is a loud, persistent architect of your internal landscape. Are you seeing xanthomas, those small, yellowish deposits of fat lurking near your eyelids or joints? Is there a persistent, dull ache in your calves after a short walk, a sign that blood flow is struggling to navigate compromised pathways? These are not merely cosmetic quirks or aging artifacts. Your immune system, designed to be the ultimate guardian, has been pushed into a state of hypervigilance. This is the true cardiovascular crisis, an unending cycle of injury and repair that turns your vessels into rigid, inflamed conduits. When you focus solely on lowering cholesterol, you are merely policing the delivery trucks while ignoring the riot happening in the street. It is found in the restoration of endothelial health, the delicate lining of your veins that dictates how blood flows and how pressure is regulated. Your body is not a machine that breaks down, it is a living ecosystem that loses its rhythm. The path to longevity is not paved with suppressed markers, but with a resilient, thriving vessel wall. You have the agency to change the terrain. This content is for informational purposes only. I know this information challenges everything you've been told, but it's the first step toward true clarity. We're just getting started.